Fear is running high as the death toll rises in Mexico's capital city. The worried line up for testing, their faces covered with masks. The government in this city of 20 million closed all public places, including schools, in a desperate attempt to stop the spread of this strain of flu never seen before.
This begins to look like a new influenza virus strain that could do a lot of mischief around the world.
Now, officials are also concerned tonight because they have discovered this new strain that has killed so many in Mexico is in fact the same strain to sicken people here in the U.S.
Health officials warn this could be a pandemic. What does that mean exactly here?
Could be is operative is what you have to talk about. Let's take a look at how they do the ratings. Right now, on a scale of 1 to 6, they say that this outbreak is at a 3, where there is no evidence of, or there is no or very limited evidence of human to human transmission.
We don't want to alarm people, but when we saw SARS, people got sick and died, and then we saw, as I said, monkeypox and bird flu, and then these things just kind of went away. How concerned should we be here?
I mean, it is possible that that could happen here as well. Again, the cases that we've seen, 10 cases, these people are mildly ill. They didn't even know that they had anything as strange as swine flu.
We are closely monitoring the emerging cases of swine flu in the United States. And this is obviously a cause for concern and requires a heightened state of alert. But it's not a cause for alarm. The Department of Health and Human Services has declared a public health emergency as a precautionary tool to ensure that we have the resources we need at our disposal to respond quickly and effectively.
40 cases of the illness have been confirmed in the U.S., 28 of them students at a private school in New York City. The infected youths had recently returned from a trip to Mexico. Other states where cases have been reported are California, Texas, Ohio, and Kansas.
The CDC, the public health community, and the World Health Organization all have said that closing our nation's borders is not merited here.
So here's where we are tonight. The number of confirmed U.S. cases of swine flu now totals 94 in 11 states from coast to coast. Maine added to the list tonight. But the cases, of course, are concentrated in New York and the southern border states of Texas and California. Add to that the 3 probable cases we've been talking about in Wisconsin. And also, we learned of 9 other probable cases, 3 adults and 6 children in northern Illinois.
We have 2 new outbreaks of the swine flu to report in this country. One of them has turned deadly.
Okay.
Let's go right to CBS News correspondent Nancy Cordes in Washington. Good morning, Nancy.
Good morning, Maggie. Well, we're still gathering details, but the CDC now confirms that a 23-month-old from Texas has died, the first death from this virus that has been reported outside of Mexico. We're also learning this morning that more cases may have popped up in Chicago, leading public school officials there to close at least one school. Now the White House is calling it an abundance of caution, asking for an abundance of money, asking Congress for $1.5 billion to help develop a vaccine, boost antiviral stockpiles, and monitor the outbreak.
The disease has killed almost 160 people in Mexico where it began, with almost 2,500 more believed to be infected. And as we reported, the headline this morning in the U.S., there has now been 1 death.
Let me ask you this, because there's been now a sort of a blowback. People are saying, well, there's too much coverage. It's creating panic.
It's complicated by the fact that scientists still aren't sure just how dangerous this flu is. On one hand, it has all 3 hallmarks of a potential pandemic. A unique virus never seen before, easily transmitted from person to person, with a demonstrated ability to kill.
The swine flu virus still spreading around the world this morning. The World Health Organization has raised its alert level to 5. That is the second highest level of warning. That means that all of humanity could be threatened, and they're worried about the potential for many deaths around the world.
The World Health Organization says we're now at a level 5 in terms of the threat. By their definition, that means that a pandemic or epidemic over a wide geographic area is now imminent. Last night, the president said no plans to shut down the borders between the U.S. and Mexico, no plans even to curtail commercial air traffic or travel between the 2 countries. I think some people this morning, Mr. Vice President, may be shaking their heads, not understanding that. Help me out.
We have contacted and been in constant contact with the leading health experts, both in the world as well as here in the United States, and they have suggested that that is not the way we should move.
A member of your family came to you and said, look, look, I want to go on a commercial airliner to Mexico and back within the next week. Would you think it's a good idea?
I would tell members of my family, and I wouldn't go anywhere in confined places now.
Within 2 hours, the White House released this statement from the vice president's spokesperson, which reads in part, the advice the vice president, is giving family members is the same advice the administration is giving to all Americans, that they should avoid unnecessary air travel to and from Mexico. I think the vice president, if he could say that over again, he would say if they're feeling sick, they should stay off of public transit or confined spaces, because that is indeed the advice that we're giving. To suggest that people not fly at this stage of things is a broad brush stroke bordering on fear-mongering.
If you feel sick, if you are exhibiting symptoms, flu-like symptoms, coughing, sneezing, runny nose, that you should take precautions, that you should limit your travel. And I think he just, what he said and what he meant to say. Jake, I understand what he said. I'm telling you what he meant to say.
Well, part of the reaction is eye rolling, and there goes Joe Biden again, and we know Joe, and that's what he does. He's not a loose cannon. Sometimes he's a whole flotilla. But this was serious because it had potential economic effect.
The World Health Organization says there are 331 confirmed cases with thousands more suspected. If we move to the United States, we see now 17 states affected here, 131 cases and 1 death, according to the Centers for Disease Control.
The virus has even touched the Obama administration. An Energy Department staffer who traveled to Mexico preparing for the president's trip 3 weeks ago has contracted the flu.
This new virus, this virus that we're dealing with now, is sensitive to both Relenza and Tamiflu. It is a strain of a virus that we have never seen before in humans. In fact, we've never really seen it before at all.
According to the latest figures here at the command center, there are now 91 confirmed cases of H1N1 virus in 11 states, but they say those numbers are changing all the time. Early estimates indicate the H1N1 strain is slightly more contagious than the typical seasonal flu. Because most countries are now advising against travel to Mexico, airlines are starting to slash service, some by as much as 50%.
This H1N1 flu has had its biggest impact in Mexico, where it's claimed a number of lives and infected hundreds more. Thus far, the strain in this country that has infected people in at least 19 states has not been as potent or as deadly.
Do you expect more deaths in this country?
You know, it's important to put in perspective influenza. Each year during seasonal flu, we see 36,000 deaths in this country, 200,000 hospitalizations. With a new strain of flu, a strain of flu that people don't have immunity to, you would expect that there are going to be hospitalizations, and unfortunately, there will be more deaths.
So many people have asked, why didn't you close the borders, Secretary Napolitano?
Well, because we've relied on science and epidemiology, and the epidemiologists say, the scientists say, it would have done no good at all and come at enormous cost.
Across the United States, New York, Texas, and California have the most reported cases, while 32 other states also now are reporting patients testing positive, bringing the total here in the U.S. to 245 cases.
Wiener is the 6th person to die in this country and the first in the outbreak here in New York City. An outbreak that health officials now tell ABC News is spreading more rapidly than the seasonal flu.
The World Health Organization has declared a swine flu pandemic as the disease continues to spread around the world. Globally, the number of known infections has climbed to close to 30,000, with more than 140 deaths.
A government advisory committee today decided who should be the first to get a vaccine. At the front of the line are people who are most vulnerable to the disease. Pregnant mothers and healthcare workers are at the top of the list. But supplies will be limited, and the first doses will be dispensed later in the flu season than health officials had hoped.
The federal government hopes to have 120 million doses of this vaccine on hand by mid-October, about the start of the flu season, and then 80 million doses a month after that.
President Barack Obama urgently convened his flu team at the White House today.
I don't want anybody to be alarmed, but I do want everybody to be prepared.
Flu vaccines are in trials right now, but the earliest they could be ready is October. A spike in the H1N1 virus could come sooner. Since the first outbreak of the H1N1 virus last spring, more than 1 million people have been infected. 553 have died. Public health officials are preparing for a second surge as school starts, but they're not necessarily predicting one.
This morning in Health Watch, the H1N1 vaccine. It is now being rushed out the door to clinics all across the country, according to the CDC and the distributor. If the vaccine is being rushed out the door, will it arrive by early October as expected in doctors' offices?
Well, it will start to, but this does not necessarily mean that you would be able to get it from your doctor starting next week. There are significant logistical issues that are at play here, and in speaking to numerous government health officials, they say we can anticipate possibly a little bit of a bumpy ride.
As the H1N1 vaccine continues to trickle out, at the few clinics that are open, the only thing bigger than the lines is the frustration.
I want to punch somebody. We've been here a long time, and my kids are going crazy. But if I would have known it would take this long, I would have taken my kid home and actually gotten a good nap out of this whole thing.
After months of urging people in priority groups like children and pregnant women to get the vaccine, the CDC acknowledges that the vast majority of them cannot.
We're nowhere near where we thought we'd be by now. We're not near where the vaccine manufacturers predicted we would be.
No, I don't have the shot, but he has the shot, and I feel a lot better. That's why I waited in a line for 5 hours.
5 hours?
5 hours.
Many clinics like this one limited their supply to those most at risk, babies, young children, and pregnant women. The Centers for Disease Control says H1N1 has spread to 46 states. More than 1,000 Americans have died, and more than 20,000 have been hospitalized. So much like a disaster declaration before a hurricane, the president today declared the swine flu a national emergency. The White House says it's not meant to scare anyone. It simply loosens some bureaucratic red tape to make it easier for hospitals to get what they need should the epidemic get worse. Delays in producing the H1 vaccine means some of the children we saw getting shots today may have trouble getting the recommended second shot a few weeks from now. The White House said there'd be 120 million doses of the vaccine available by this fall. They've cut that prediction to 50 million doses they hope to have ready by mid-November.
The demand for the H1N1 vaccine continues to outstrip supply. Nationwide, only 11 million doses have been distributed, not the 120 million federal health officials had expected to have by now. The virus seems to target young people. 100 children have died so far this year.
46 states are reporting H1N1 as widespread, with more than 1,000 deaths and 20,000 hospitalizations. And while an average case is usually no more dangerous than other flu, this strain has its unknowns. 30% of the deaths are in healthy people with no underlying problem.
What do you say to families who've gone, waited, couldn't get the vaccine? What do you want them to do for these days?
I want them to come back. I hope that people aren't discouraged, and I know it's frustrating to wait in line, and particularly if you end up with no vaccine.
I know concern has been expressed that 4 out of the 5 of the manufacturers of the vaccine are overseas, not in this country.
That's right.
How did this happen, and and should it be changed?
Officials from the Obama administration called for patience today as people wait and wait and wait to get the flu vaccine. Health and Human Services Secretary Kathleen Sebelius defended the government's response to the virus, saying it is more robust than ever in the history of this country.
There are faster, more reliable ways to make vaccines that some companies insist could have been ready by now. The Connecticut company has already produced 100,000 doses of the new H1N1 swine flu vaccine, but it's being tested for safety and effectiveness in Australia, not in America.
Why didn't you test the vaccine here in the U.S.?
It's because the U.S. government wouldn't pay for the trials, and the Australians did.
Leaving Americans today with one less resource in the race to make vaccine.
Now to the latest on H1N1 and new figures showing a 4-fold increase in its death toll. On Monday, we reported on the early show that the number of deaths blamed on the flu outbreak was being underreported. Well, now, the latest figures from the CDC show more than 4,000 Americans have died after coming down with H1N1.
The government now believes roughly 8 million children have come down with the virus. In addition to the 540 who have died, 36,000 have been hospitalized. Among adults 18 to 64, there were an estimated 12 million cases, 53,000 hospitalizations, and almost 3,000 deaths.
What we are seeing in 2009 is unprecedented.
The CDC estimates that 22 million Americans have gotten the virus, and close to 100,000 have been hospitalized. 8 million children have been infected. 540 of them have died.
Current estimates are that 15% of the U.S. population has been infected with the 2009 H1N1 virus, resulting in some 265,000 hospitalizations and 12,000 deaths.